Hi everyone. Let us talk about recurrent pregnancy losses. So one stigma women always have is not having a child and then having abortions. So why do we call it as recurrent pregnancy losses? When do we start investigating them and evaluating them? Previously, till 3 abortions we were not bothered, but in today's time, even with 2 abortions, we start evaluating and investigating. And I think when a woman can afford or a couple can afford, there's no wrong in evaluating even with 1 abortion also. But like I said, guidelines, 2 abortions we start evaluating. Why does it happen? First, genetic analysis is done. Both the couple analysis is done and genetic, if we find any abnormality, genetic counseling is done. Second reason would be antibodies. It can be an antiphospholipid antibodies, anti-nuclear antibodies, anti-thyroid antibodies. And then it can be diseases, medical diseases like thyroid, and then it can be a diabetes which is not detected before. Apart from it, we have other causes like if you have a clotting disorders, that is we have a homocysteine being high or protein C, protein S deficiencies or even antithrombin deficiencies. So these deficiencies also will have a prothrombotic effect where blood starts clotting and the abortions can happen. And then we also look at certain genetic abnormalities like factor V Leiden deficiency or even MTHFR mutations or something which we look at. And then certain infections can cause recurrent pregnancy losses like torchitis, like toxoplasma, rubella and CMV and herpes. But usually we don't do these tests unnecessarily. We go step by step and doing it. In spite of all these tests being come and somebody has abortions, that's when we do a natural killer cells. They will have some sort of immunological cells which are called natural killer cells which can go and kill the babies there. So when we have this, according to the cause, then we go ahead and start treating the patients. So what we have to do is always first evaluate the patient, why they are having the abortions, and then according to the trimester we take into the reason. First trimester when abortions are there, most common cause would be a genetic abnormality of that particular baby or the couple. Second trimester, most common causes would be the anatomical problem like a septum. Septum is something which is like a layer in between the uterus, so baby when sits there will be aborting. So we do a hysteroscopy and laparoscopy and we cut the septum, otherwise it is very difficult for the baby to go till the term pregnancy. And cervical incompetence is when cervix is very loose, so baby it does not hold the baby. That's when we put a stitch there. So this is what we look at when we look at anatomical abnormalities in the second trimester. Certain people can have a bicornuate uterus or didelphys, again which do not go beyond a time. That's when we do a unification surgeries. And suddenly the intrauterine death can happen when there is an ANA positive, or when you even have a diabetes which is not under control, or sometimes infections like I told you. So all these tests have to be done, evaluated depending on the trimester, first trimester, second trimester, third trimester. First trimester, when you want to know, we send the products for genetic evaluation, that chromosomal array, microarray, or second trimester, if definitely it is a cervix or the thing, we can send the baby also for autopsy or the placenta for evaluation also. So if there are multiple abortions, please get evaluated why it is happening. Very rarely immunological reason will be there against the paternal antigen. That's when immunotherapy is also done. So find out the reason, evaluate, find out the reason, then treat it. Then the chance of next pregnancy losing will be very, very less. So talk to your doctor today about your recurrent pregnancy loss.